Hi there, I'm Dr. Shauna Dingman from Elevate Women's Health Center, and today I'm going to show you some low back strengthening exercises. This is part 2. So if you scroll back in my YouTube videos, you'll see low back exercises part 1. So if you're a patient of mine, or even if you're not a patient and you just want to get started with some good strengthening exercises to take the pressure off your low back if you're suffering from low back pain, start with the part 1. Give yourself at least a week or a couple of weeks of that, and then you can try this video, which is part 2. So I'm just going to basically up the level of the strengthening for your low back. So there's a couple of different exercises that I'm going to show you. I'm going to show you the exercises. I'm going to show you a couple of modifications that you can do. So you can try them with me here in this video. And then what I want you to be able to do is usually about 10 to 15 reps. Either if it's a unilateral, like just a regular exercise, do it 10 to 15 reps. If it's something that you would do side to side or both sides, you want to do it on both sides. So the first one that I'm going to show you is called a one-legged crunch. So I'm not a huge fan of crunches. You probably know that if you've watched any of my videos, but because we're strengthening core, you've got your front abdominals, you've got your back spinal muscles, and you've got everything in between here that serves almost like a girdle belt. And so we do need to focus on making sure that we've got good core strength in the front as well as the side and the back. So this one's gonna help your front. What I want you to do is drop one leg down. Let me see if I can get in the whole screen here. Drop one leg down, but keep one leg up. So if you had both legs down, it's gonna compromise your back. If you put both legs up, it's a much harder exercise to do. So it's a good compromise to have one leg down and one leg up. And there's a couple of different ways you can do it. If you want to support your neck, you can just interlace your fingers behind your head. Don't pull up, just support the weight of your head as you simply focus on bringing your rib cage closer to your hip bones. So it's a tightening in those abdominals as you approximate your ribs to your hips. So you can come up like that and down. You can come up, you can even hold it for 2 seconds and down. Or if you want to do it differently, you can have both hands overhead and you can come all the way up. So I use momentum to go the entire range of motion, but most of the work is being done by my abdominals approximating my hips to my ribs. I breathe out as I'm coming up and inhale as I'm going down. So that's the one-legged crunch. Okay, the next exercise I want you to do, we're gonna focus on your obliques or the side abdominals. And what you're gonna do is lie on one side, and again, there's a couple of different ways you can do it. You can either keep your legs sort of on the ground and, let me think about this for a second. Oh yeah, keep a leg on the ground, and what you're gonna do is just push that hip up in the air. You're gonna feel it squeezing in through here. That's where you should be feeling it. I would start with just 5 to 7 of these. They're quite tiring, and you'll feel it in your glutes as well. Another modification, if you can, is you can come all the way up and you can do it like this. You're squeezing those abdominals, these ones here, together. Okay, that's another way of doing it. Or you can do it on a forearm and you can come up like this. Or you can even do it, can you do it like this? Maybe you can. Yeah, you can even do it like this. So you choose which variation is going to be the easiest for you. Start with the easiest variation to get used to that feeling. And remember, you're bringing your ribs and your hip on the downside, on the carpet side, closer together. And then, as you get better at it, as you get stronger, you can try a different variation. Careful of your shoulder too. If you are coming all the way up like that, just make sure that your shoulder is directly over your wrist. Okay, and then obviously flip over and make sure you do it on the other side. So we've got our one-legged crunches, we've got our hip raise oblique crunch. The next thing that I'm gonna show you, I call them Supermans, or I guess it's Superwomen if you're a woman. I love, love, love this one. So again, I'm gonna show you 2 variations. You've probably seen this before, especially if you do yoga or if you've done any kind of core strengthening, but you're gonna lie down Stretch yourself out. And a Superman is just, you're literally just squeezing all of this together and bringing your hands and your feet off the floor. Hold it for 2 or 3 seconds, okay? So if you need an easier modification, just do one at a time. Opposite arm to opposite leg. And then the other side. And relax it. And again. And relax it. Or, like I said, you can do both together. Make sure you relax it. The other modification that I love for this, especially if you have a lot of upper back pain and neck pain, is to come up and then pull like this. So it's a scapular retraction. Focus on bringing your shoulder blades closer together at the back. So you come up and then retract and down. Make sure you let go. When you come down, it's a full relaxation. Relax all the muscles. Come up, retract, and back down again. So again, start with 10 of those, work up to 15, but you shouldn't need to do more than that. And the last one, again, one of my favorites, sort of a basic back muscle strengthening all the way down the extensors of your spine, is plank. So I'm a huge fan of plank. I find even if the only exercise of these 4 that you did was planking, you would probably notice a big difference in a short period of time with your low back pain. So proper plank has you with the shoulders over your wrists. You want your back to be one straight line, okay? So I would do this in front of a mirror. If you're not used to doing this yet, do it in front of a mirror, because I did all sorts of wacky things with my body before I realized what I was doing. And all you do is you just hold it. What you are doing though is making sure that in this position, you're contracting, you're squeezing your hamstrings, which are the top backs of your legs, your thighs, your glutes, so your bum, and your tummy. You're sort of squeezing everything together as you're doing it. I would recommend starting 15-20 seconds of plank. If that's easy for you, keep going. Go as long as you can the first time. Just time yourself and see, can you do it for 30 seconds? Can you do it for 40 seconds? If you get to a minute, I think a minute is awesome. Most people can't plank for a minute. So if you even started at 15 seconds and just worked up by 5 seconds each week for a while, eventually getting to a minute, I think that's probably lots. Let me show you an easier modification. So if you have wrist problems, what you might want to do is just come down on your forearms. I actually almost find this is a more difficult plank, being that much closer to the ground. So it's a modification, it's just as effective. If that's hard, you can start by going like this, having your knees on the ground. You can have your knees on the ground and your hands up. So if your knees are on the ground, you do want to move to a point where you can get those knees off the ground, because you'll find that's where you get a lot more strength in your core from doing that. Okay, so just to review that, we've got the one-legged crunch, we've got the oblique hip raises, we've got the Supermans or Supermans with a modification, and we've got planking. 4 exercises. Your planking work up to a minute. All the other ones do 10 to 15 on each side, or 10 to 15 if it's not a one-sided exercise. If you have any questions at all, you can message me. You can email me, drshauna@elevatewomenshealth.ca, or you can place a comment at the bottom of this video, and I will get back to you as soon as I see it. Have a wonderful day, and I hope your back feels so much better in the next couple of weeks. Stay with it.